Greetings to everybody. I'm Utpala, a student from the School of Music Therapy following the PG Diploma in Music Therapy from the Institute of Salutogenesis and Complementary Medicine at Sri Balaji Vidyapeeth. Medmuzine is a student initiative, a magazine done by the School of Music Therapy. And as a part of Medmuzine, we are conducting alumni interviews. And today I'm very glad to have Ms. Jenita Caren with us, who is an alumni of the School of Music Therapy, who has finished the M.Sc in Medical Music Therapy and currently working as an assistant professor at the School of Music Therapy. Welcome, ma'am. Thank you for allocating your time on this busy schedule for us.
Thank you for having me.
So, very excited to have this talk with you. I would like to begin with your background. Would you be able to brief about yourself, like prior to music?
Prior to music therapy, I'm basically from Chennai. My family is based in Chennai only from when I was born. And before music therapy, I was a musician. I play the piano a little bit. I play the flute, the recorder, and I also sing. And both my parents are musicians. My family is a musician family. So I'm a musician basically. And then after my schooling in Chennai, I did my undergraduation in audiology and speech language pathology in Trichy, not in Chennai. And after that, after finishing that course, straight away I joined for the master's program in music therapy. Yeah.
So, having a background in speech pathology, how did you build interest towards music?
Naturally, as a musician, I've always wanted to do something with music, but like most people say, being a musician may not be very stable for life. I don't know if it's a myth or not, but it's there. And as a person, I also have interest in the medical field, working with children with special needs. So that was the reason why I joined for the speech therapy course. And during the speech therapy course, as I was studying, I came across this term of music therapy and came to know that music therapy is effectively used with children with special needs, especially autistic children. I was really intrigued by it because it is something which I can do with all my interests like research, medicine field, children with special needs, and of course music. So since this is a place where I can integrate all my interests, I came here to study.
Does it say that you are passionate about research?
Yes, I am passionate. Like as a student in my undergraduation, also I have done 2 to 3 research projects, and as a student, I have published one of my papers. I actually came to Pondicherry during my undergraduate study to present one of my papers and got the best oral presentation award as well. So yeah, I am interested in research.
Alright. So, how did you come across the M.Sc in Medical Music Therapy at Sri Balaji Vidyapeeth?
As always, how everybody finds things, I also went to Google and I typed music therapy courses in India. So this was the only master's degree that I could find. I also found out PG diploma courses in different places, even though it was available in Chennai, which is my hometown. I wanted to do it as a degree and not as a diploma. So I came here, even though it is far away from home, I came here for the master's degree.
You are the first full-time master's degree student following the M.Sc in Medical Music Therapy. Can you share your experience regarding that?
Yes, actually, even coming here for the interview, they asked me this similar kind of question, saying speech pathology is such a good field, why are you coming to music therapy? So I kind of gave the same answer, and I actually told music therapy is also a good field. And yeah, I can integrate my interests here better, and I think I'm well here. That's what I told them. And I was the only student in my batch, and unexpectedly it went really well. I actually enjoyed being the only student. I could concentrate more, I guess, and I got more special attention. I had individualized, customized classes, and deadlines were up to me mostly. So there were no competitions. And as an individual, also, I enjoy doing individual projects rather than group projects. I can do group projects. I have done group projects, but I think I learn better when I learn alone and then go with my peers and discuss. I learn alone and then discuss. Learning together might be a little difficult for me in some aspects. Like listening to a lecture as a group is okay, but sitting and learning I have to do alone. So this place actually kind of enhanced that. So it was a good experience. It was not bad to think that, oh, only student would have been bad. No, actually, it was really good.
So, ma'am, you are a member of the Publications Commission of the World Federation of Music Therapy, representing Southeast Asia. Did you have any similar opportunity or exposure in your student life?
Actually, becoming a member of the Publications Commission of WFMT started in my student life. I actually was recommended for the commission when I was a student here, and then now I am completing the last year of that course of 3 years as a professional now. So I started off as a student in the commission and now ending it as a professional. Hopefully we'll be a part of more commissions.
Talking more about your student life, you have 2 copyrights and 1 book chapter as a student. Anything to mention about that?
Yeah, I would say this university, the faculty that I had, they really identified my potential of being able to write, and they gave me the opportunity to write, because doing a copyright individually out of this university, I don't know if I would have pursued it, because the process itself is very lengthy. I don't even know what the process is. That's how SBV has made it easy for me, because they take care of all the legal aspects. They pay the lawyer. They help us do it. So it was fortunate of me to have gotten the opportunity here in SBV to write and make the copyrights, and I'm also very grateful to my teachers to have trusted me and given me the opportunity. And it's really wholeheartening experience to see that a lot of students now also use those copyrights that I have made as a student. So I'm very fortunate to have gotten the opportunities.
Having been in the field of music therapy for several years now, is there any change in your perception of music therapy then and now?
Before music therapy, it was a positive thing that I didn't have any perception, because maybe I didn't have time to think. I don't know. I was doing my speech pathology and audiology course, and there I was working with a lot of clients in my student life, because the course is designed in such a way that we need to have theory classes and we have practical exposure by working with clients. So I was already a half therapist there. So when I thought about music therapy, I didn't have this common misconception that, okay, we listen to music and then everything is going to be fine. I never had that misconception, like we call it, before I came here. So I naturally thought that, okay, there might be some techniques as there is in speech therapy to work with clients, and I'll be using that. And one more fortunate thing that I did was, before I came here, I fully whitewashed the SBV website, the Center for Music Therapy, by then the website they had, and also the curriculum booklet that they had online. So I read all of it and I understood that, okay, I'm not going to learn music here, I'm going to learn the anatomy, physiology of the human body, how it works and what effect does music have, and how I can use the music which I already know in the therapeutic aspect. So my perception has evolved, but it has not really changed.
student, I would like to know how is it the transition from theory to practice? You talked what you gave a brief idea about what you learned. How is the transition from that theory to practice?
Theory to practice, usually all the students who come here have that 6 months of theory and then only they start the clinical practice. But for me, as I already told, the faculty here really can identify your potential. So since I already had the experience of working with clients, I actually had only a month's break to learn theory. I was learning theory and simultaneously I was also put into clinical practice considering that I had some experience working with the client population. So it was not a big break for me, and it was fortunate for me to have not gotten that break because I would have lost touch of going and meeting people. But still, there were transitions in the way I work because when it comes to more than speech pathology and audiology, the questions that we ask the clients is very technical. Is your ear paining? Do you hear the sound that I'm giving? It's very, I'm asking something, they answer close ended. So I didn't really have this concept of therapeutic communication or therapeutic relationship that we have in music therapy there. In speech pathology, there was therapeutic relationship, but maybe as a student, I didn't really know the importance of that. But that really changed a lot when I came to music therapy because the way I converse changed when it comes to the patients and the caretakers. So yeah, that is the major transition that I had.
As an assistant professor, now what difference do you see in yourself?
Personally, I feel that I've become more confident. The opportunities that I was given as a student, for example, being a member of the commission, World Federation of Music Therapy Commission, having done copyrights, writing a book chapter, all these experiences gave me a lot of inputs to make myself more equipped with me and how to talk to people because in the publications commissions also, I was the only student there. I was the only master student there. There was another student, but she was a PhD scholar, and the others were all professors and people who were working in hospitals. He was much more elder than me. So there, I got the opportunity to be in a professional environment and communicate with people. So even as a student, in the initial stages, I used to observe like how people are communicating. I didn't know if I should call them ma'am, sir, or if I can call them by name. So I took that time to adapt, but those are the opportunities which gave me this not fully confidence, but at least a small amount of confidence that I have, being able to talk to people and going for a class and taking lectures, and also as I told, learn more than learning from lectures. I am a person who has to sit alone with my books, make my own notes, and learn for myself. So as a teacher, I'm constantly learning because I want to teach my students. And I always feel that if I go for a class, no, I should be 150% thorough because I want to answer whatever questions my student ask in the most equipped way. So I really, and I enjoy learning as a person. So I really sit and study a lot. So that also has contributed to the amount of confidence which is building inside me as a music therapist and a person who can go and speak. And even now as a faculty, I also go outside to the community areas and talk about music therapy for awareness as a music therapist. So those opportunities also, like just going there, standing in front of a bunch of people and talking is also contributing to the confidence level. So majorly I would say confidence has improved in me.
So ma'am, it's very clear that you are multitasking. How do you really strike the balance between your current role as an assistant professor, music therapist, speech therapist, and now as PhD candidate as well?
Thank you for the question. Listening to the list of things that I'm managing now from another person seems like a lot of things, but I would say that I'm really inspired by the people I work with and the people who work above me, like art director sir, vice principal ma'am, administrative in charge, all of them. That there are more things that I can do for my age and the free time that I have as a person who's not yet committed to a family life and all. So yeah, I feel I can do more a lot. But with what I have now, I try my best to manage things by being organized. That would be the basic thing for me, I would say, because I try to make myself comfortable by making lists every day. I have a notebook where I make lists of things I should do, what I should focus on, which I need to prioritize, and what should be done. But in that also, I try my best not to, say myself that no, you should finish this today, confirm. I don't do that because it'll just add on to my stress and I will not do anything on the list. So I just put it there as a visual cue for myself to know what I'm supposed to do and what I'm supposed to prioritize first. So basically being organized will make me comfortable and it's helping me manage the things that I have and also manage my health and personal life as well. Yeah.
So, as a music therapist, do you see a career or is it more towards teaching?
I would definitely say that I am leaning more towards teaching and becoming a better teacher than I am now because I've always had this interest of learning alone by myself, getting information, and then going and telling it to people. Even in school, I remember teaching to my friends before the exam days, and they used to come to my home. We do group study where I'm teaching them. And even in college, it was a common ritual that we had that before the exams, I would go. My friends would make me stand in front of the class. I used to have notes in my hand, chalk piece, and everything. I used to teach. I really enjoyed doing the seminars that I was given by my teachers, both in undergraduation and in my post-graduation. And interestingly, I also have a very fond memory from my childhood, from my school days, where I was very little. I remember saying to someone that I do enjoy teaching, but I don't want to become a school teacher. So I'll become a professor. So it's almost overwhelming to know that the small like aim that I had as a very small child is becoming true now. So it's really overwhelming, and so definitely I look at myself in the future as a better teacher. But I also look at me working with children with special needs using music therapy and speech therapy because I've always had this passion towards working with them. And now even my PhD is focused on working with children with autism. So yeah, mostly it will be teaching, but a little bit of music therapist in children with special needs as well.
So, before wrapping up, ma'am, you may have something to share with the current student.
So for the current students, first point is basic like work hard, don't waste time, be organized, use the opportunities that you have. Because as I've already told in SBV, they do give a lot of opportunities for creating copyrights, for publishing, and also I would like it if my students use those opportunities to become better in their professional career. And also, as we teach in classes, like every patient is individual, every patient is unique. So we teach, I teach, at least me, I teach my students to analyze their patient well, know them, and then tailor make the experiences for them. And I'm sure my colleagues also do the same teachings for their students. But when it comes to a therapist, the therapist is also a human being who's an individual, and I believe that each person has a therapist within themselves. And since all these students who come here to study music therapy have that strong feeling that they want to help people, that individual therapist is more enhanced. And I want my students to really find that unique therapist within themselves and not just follow videos that they watch or me or the other faculty here or their friends or their seniors or juniors. I want them to find the individual therapist that is within themselves, which the therapist is already there. They just have to find what or which therapist it is. So I would say the students have to explore and play around with the techniques and methods that they learn because this is the phase where students can try out different things. So because faculty, we have their back, and whatever they do, we are going to teach them. So if they explore and do the right things at the right time, I'm sure they will all find the individual unique therapist within themselves. And it would be really, really nice to look at them as that individual therapist in the future.
I would like to add one more final question, ma'am. This is not in my agenda, but listening to your story, it seems very positive. Everything is flowing nicely. If I say, okay, her story is very beautiful, very positive, am I right?
It is happy to know that my experience looks like a bright picture with a lot of positivity and colors. But whatever, however bright the picture is always going to have a shadow behind. So I did have a lot of hardships, and I worked hard a lot. I worked overnights. I used to study a lot. I went down in my physical health also, because at one point I had to go for 4 different clinical postings for a same day. So that was overwhelming for me, and I also overworked myself because I was doing clinical postings, I was doing documentation, portfolio writing, I have to attend classes, I have to do the assignments, I have to do studying. Then I also did the copyrights, book chapter, I tried to write some articles, all that. So all these hardships are the ones which led to this beautiful painting that I have as a professional life right now. And I will never say that I won't go find loopholes to, if I had a chance to go back and have the same journey, I would never find loopholes to not have those hardships and come to this picture. This picture will not be beautiful then. I will undergo the hardships again, because that is what has led to this beautiful picture. So yeah, it was not easy, but it's good to know that it has led to something positive.
Thank you very much for sharing, ma'am, because your story as a student, like the only student in the batch, is personally very inspiring to me, because I am the only student in my batch. So thank you very much for sharing your full story with us, and I'm sure that those who are watching this will also truly be inspired by that. Thank you.
Thank you for having me.
Thank you.